Good morning, everyone. Today is Thursday, February 16th. I can hardly believe it. We're a month and a half into the new year, and it's going very quickly, and as predicted, things are changing very quickly. So with our new section on the new administration, we're going to keep this segment of the ACA webinars just so we can keep abreast, at least try to keep abreast of all of the changes. New and upcoming. So first on the format, Secretary Tom Price was sworn in as HHS Secretary. There was an interview done with President Trump, and he said that that he suspects that as soon as Secretary Price is sworn in that there will be an immediate release of a repeal and replace plan. However, that's not occurred. I don't have any further information on the elimination of the individual tax penalty and or the employer mandate, but there is some interesting news that I discovered today, and it's actually going to be in my newsletter next week, and it's also in the NAHU newsletter, daily newsletter. But there's an article that says earlier this month, the IRS quietly altered its rules to allow the submission of the 1040s with nothing on line 61. Now, as you may or may not know, line 61 denotes whether the person had qualified health coverage or not. It does go on to say that the IRS says it still maintains the option to follow up with those that elect not to indicate coverage status on line 61, but there's no indication of what circumstances would trigger that sort of audit. So that's huge. And, you know, obviously if the individual tax mandate or tax penalty goes away legislatively, then we'll know about it. But this one is kind of interesting because it's almost indicating that, you know what, they're not going to really enforce it. Now, again, I'm not saying that they're not. I'm just telling you what this article says. So without an individual tax penalty or the enforcement of an individual tax penalty, it's going to be interesting to see what plan options are going to come about and what the consumers are going to choose on the individual platform. The employer tax mandate for the 50-plus employers, I've heard nothing on that at this point. PA plans for 2018 are being designed, and this is an interesting bullet point number 3 because we met with a major carrier on Tuesday, and I asked if they had heard anything from the state or federal level about filing the plans for 18 on the individual chassis and what, you know, what changes they see in the filing requirements. And at that point on Tuesday, there was nothing. Now, on to point number 4, there was a release yesterday of the ACA Stabilization Rules. Most notably, the one change is that they're going to implement or try to implement a 45-day open enrollment period running from November 1st to December 15th versus the November 1st through January 31st that we have in place now. Other things of note would be the guaranteed availability. The rule proposes to address potential abuses by allowing an insurer to collect premiums for prior unpaid coverage before enrolling a patient in a new year plan. So that's kind of interesting. Network adequacy, qualified health plan certification calendar, that's been delayed because most carriers for the last 4 years have had to file their plans for the next year by April or May. So that seems to have been extended. There is a comment period that the comments are due on March 7th. So the information is in my newsletter from HHS about the proposed rules. If you care to comment on that, please do that and make notes by March 7th. On to the next information point. The National General Short-Term Medical, there is a new process for adding and deleting dependents. And essentially, in previous years, if somebody had to terminate an employee or a person, family member, they'd have to write a new application, which would trigger new qualifications, new deductible. So again, this information is in my newsletter, but if you have questions on the new process, if you have a National General short-term medical plan and you have to delete someone or add someone, give Judy a call or myself a call, and we'll give you that information. Just of note, the House Resolution 552, there is a proposal on the floor that eliminates the short-term issue limitations that exceed 89 days. So as many of us know, as of 4/1, any short-term medical plan that is sold cannot exceed 89 days in duration. It's not saying that you can't rewrite on another short-term medical with the same carrier or another carrier, although some carriers are interpreting the rule differently. But again, this HR 552 may take care of all of that. And Vince's Corner and the questions that are asked in my weekly newsletter. This is a new feature, but I wanted to let you know that your responses are being heard. Everyone that replies and gives a response, I am forwarding that information to Vince, and he is in turn taking that and supplying that to the leadership in our state. And also they just spent the first 3-4 days in Washington at the Capitol Conference talking about these very issues. But what I did is I attached in your handouts the agent comments on the House bill. This was Vince's House testimony. And then the agent comments, that was a letter that he compiled based on your feedback on the prescription issue and sent to the state leadership, and also a copy of his testimony about the prescriptions. And again, you helped do that. So there is a question in this week's newsletter. It's the same as last. What is the biggest issue? We got a lot of responses. A lot of those responses were, about what concerns all of us, and that's commissions. But I put it in there again to see if there are any other issues other than, other than commission issues that you'd like to see addressed. I know for one that employer mandate would be awesome if that would go away, and those measurement periods. That's just my one wish. Aetna MLR letters are being sent out to determine the total average employee count. They are doing this for 2018 possible rebates. So if your group clients get this letter, please make sure that they don't discard it, that they take time and answer that information, because it could mean rebate for the group. And CPAHU and GPAHU continuing education events. This is March 3rd from 8 to 12 at the Sheraton on Lindle Rd. Used to be the Sheraton East. Right there. Oh, I'm sorry. No, it's the Sheraton across from Wolf Furniture. I'm sorry. So it is again 2 CEs and good education courses. If you want to register, that information is also in my newsletter. And for those of you that are new to the webinar formats for our weekly webinars, don't forget about our 2017 group health tools. We've really tried to meet the market demands, meet your demands that you're being asked from your group clients. And I think we've really, in fact, I know that we really have exceeded some of our friendly competitors in what they offer, and also really seem to hit home with your value adds when you're going out presenting to groups. So again, if you don't know about them, call me. I will give you that information. I'm going to open it up here for questions, but just wanted to let you know next webinar is, of course, next Thursday, February 23rd at 9:30. So let's see if we can get some questions here. We've had a couple, and hopefully people can hear audio. There was an issue, I guess, at first. Is there any discussion of, again, allowing family-only groups to get group health insurance? Dave, not that we know of, but of course if the ACA goes away, then you know, that may go away as well. It still has to be a valid group nonetheless. It can't just be a husband or a wife that says, you know, my husband does some paperwork for me every now and then. It really does have to be a valid group with UC2, ownership docs, all of that, if it's going to be allowed. And that's it. That brings us up to the end of the questions. And as always, I truly appreciate you joining in. I know it's a little rushed today. I am on to another appointment. But keep your questions coming. Keep tuning in. And I'll keep watching for all these rapid fire changes that really are, you know, from my perspective, nothing but positive. Anything to, you know, alter this law and, you know, get us back in these markets and get consumers paying what, you know, they can afford, both on the group side and on the individual side is all right in my book. So let's keep our fingers crossed and hope that change is coming quickly and it's change that's sustainable, fiscally responsible, and of course keeps us in the loop. So thanks again for joining in, and I wish all of you a great day and a great balance of the week and a wonderful, very nice weather-wise weekend. Talk to you later. Bye-bye.